TCC. So we know that the gold standard for upper tract TCC is nephrectomy. This has been there for ages, and that is the best surgery in terms of survival, in terms of cancer control, everything. But the things have changed now. So what has changed? We have got better ureteroscopes, we have got laser, we've got fibers, and we know more about the tumor biology of the upper tract, TCC. Let's talk about the diagnosis of the upper tract, TCC. Three things are a key in the diagnosis: CT, ureteroscopy, and a ureteroscopy. And I'm going to talk through it one by one. So first of all, the role of CT urogram in the diagnosis of the upper tract TCC. And this systemic review and meta-analysis reveals that the sensitivity and the specificity of the CT urogram diagnosing the upper tract TCC is very high. It can diagnose up to a 0.5 centimeter tumor in the ureter and in the renal pelvis. What it does not is flat lesions. But that also, to some extent, if it leads into thickening of the ureteric wall, it could be picked up by a good uroradiologist. And you can see the CT urogram. It's very obvious in this big tumor of the right renal pelvis, and one over there, and a smaller tumor, very, very clearly visible even to a new trainee in urology. Let's talk about urocytology. And this is a question I've been asked at various levels, that what is the role of urocytology now in the TCC? Well, I don't think there's any much role in the TCC bladder, but it has definitely a very important role in the upper tract TCC. Well, you don't need to do urocytology if there's an obvious tumor. If the CT scan I showed you in a minute ago, you don't need to do a urocytology in that situation. But in some cohort of the patients, when you're suspecting a